here at the Arthur Chung Conference Center, and with me this morning is the Honorable Minister of Health, Dr. Frank Anthony. Dr. Anthony, tell us a little bit about the Human Organ and Tissue Transplant Bill 2021.
Well, this is a bill that we've been working on for a little bit more than a year. And this is because Guyana as a country, we've started doing transplants probably about 12 to 15 years ago when we did our first kidney transplant. Since then, we have gained experience. We have sent a lot of local people to be trained in how to do kidney transplants, and they're back home. And they have been doing transplants for persons who meet the requirements for such transplants. However, our legislation did not contemplate this type of medical procedure. And so what we're doing is putting the legal framework in place to allow us to do this safely and put in all the safeguards, put in a lot of the best practices that are obtained around the world as it relates to harvesting organs, and of course making sure that we have a proper scrutinized list for donors, and those safeguards that are necessary when you are able to do these types of procedures.
Minister, outside of general medical advancement, the need for that advancement, has there been a very high demand for these organ transplants?
Well, we do have a lot of patients with end-stage renal diseases. And once you have end-stage renal disease, then you would require to have dialysis. Transplant, especially kidney transplant, has been shown to be very effective in terms of assisting patients, because they're no longer required to come every 3 times a week to be able to get dialysis. Plus there's a lot of cost when you're doing dialysis. All of this can be removed if you get a transplant, and that person can also return to almost normal work life. And so we think that in terms of renal transplant, it is a very cost-effective method. And we do have a number of patients who would readily qualify for such transplants. But this bill is much more than renal transplants. Almost any type of transplant that you can think of, we'll be able to do now that we'll have the legal framework in place. So this bill is a little bit broader than just renal transplant. In addition to that, this bill is also forward-looking because it allows us to do biobanking under this bill. Biobanking is when you save cells or tissues from a person, and you can preserve that for a long period of time. And then at a suitable time, when you need such cells, you can retrieve it and grow it and maybe use it in terms of transplanting it and so forth. So there are other forward-looking aspects of this bill, including looking at the possibility of developing biobanking here in Guyana and expanding that, and all the associated research that comes with biobanking.
And has the government already considered setting up a facility that will directly accommodate this human organ and transplant initiative?
So under this legislation, we'll have to set up an agency. So once the legislation is passed, we will set up that agency to do all the regulations of the bill. So that's one. Outside of that, our hospitals who would be doing transplant, they have to be certified by this agency. So they'll have to meet a number of requirements. And once those requirements are met, then they'll be given a special license to be able to perform transplants. Right now at the Georgetown Public Hospital Corporation, we do have transplant unit. However, they have been predominantly involved in renal transplants, and so I can easily anticipate that that unit would be expanded to look at other types of transplants.
Minister, how can this bill and the introduction of this bill be able to assist persons in terms of COVID-19 and assisting them with their recovery and things of that nature, if it can?
Well, that's a very interesting question because you would know that we have been doing blood transfusion in Guyana for a long time. So somebody, they get into an accident, they have been hemorrhaging, and they would require blood. Now, blood is a form of, when you transfuse blood, it is actually a form of transplant, as you can imagine. But we don't have legislation to cover transfusion of blood. This bill would address that concern. In terms of COVID, you would know that early in the pandemic, that we have been using blood to generate plasma from the patients who have recovered, and we have used those the plasma from those patients and transfuse that into persons who are sick to be able to give them an antibody boost. Now that is not a very popular thing because it has not been very, very effective, but it was one of the methods that were tried in the early part of the pandemic. But out of that, we have been able to identify the monoclonal antibodies that is produced by the body when somebody gets sick, and they have been able to now make those synthetically and use them in patients, and they've been working quite well. But we do have a challenge now because those that were developed and work very well against the alpha, beta, gamma, and delta variants, it's not as effective against the Omicron variant, which is now circulating in many parts of the world and probably would become the dominant variant. So the companies that would normally make monoclonal antibodies are now working on developing something that is going to be effective against Omicron.
And Minister, you mentioned Omicron and the variant. An article published in the CNN spoke about face masks and cloth face masks as quote unquote a face decoration against the Omicron variant. How is the ministry planning to address these cloth face masks and trying to help persons to use better protection against the Omicron variant?
So, a couple of things that I think we need to understand. In terms of transmission of the virus, most people would get infected if they don't have a barrier on their face, so physically to prevent the virus entering your nose or your mouth. So transmission by and large has been, at the beginning of the pandemic, it was thought to be only by droplets. So if somebody actually coughed, the droplets from the cough, if you're within range of 6 feet, that you would be able to maybe inhale some of those droplets. And by doing so, you get infected. So those were the initial thoughts at the beginning of the pandemic. That then evolved because we quickly realized that it's not only droplets, but when you cough, the particles remain suspended in air, and that's called an aerosol. And that can remain circulating in air for an hour or more in some cases. And if you're in an indoor environment where the air is stagnant, it would remain suspended for quite some time. If, however, in a room, let's say, you're able to ventilate the room, meaning you have created an airstream, so air flows from one direction to another, then these particles or aerosols from an infected person would be swept out of that room, and the room would basically be okay. So if you go into such a room, although it's empty, and you are without a mask and it has been properly ventilated, then you would not get sick. If you go into such a room and it's closed and you might feel that you're there by yourself, but you're actually there probably with virus circulating and being suspended in the air. And if you take off your mask and you breathe in that air, you can get infected. So that's how it is transmitted. Now, when you wear a mask, you're seeking to interrupt that transmission. You're seeking to break that line from an infected person to an uninfected person. And therefore, a mask is very effective. There literally, we can categorize masks in maybe 3 broad groups. You have cloth mask, you have surgical or procedural mask, and then you have N95 mask. Now, a cloth mask, because the pores in the cloth, they're really big, and viral particles can easily pass through the cloth mask. And if you wear a cloth mask and you're in close proximity with someone who has been infected with COVID,
Right.
and you breathe the air in, there is that possibility that you can get infected, although you're wearing a cloth mask. So that's something that I think people need to bear in mind. With the Omicron variant, it is highly transmissible. And it is highly transmissible because the characteristics of the virus has changed. It has about 52 mutations on the virus, with about 32 of those mutations being on the spike protein. This is the protein that attaches itself to the human cell. And because of these changes, it has caused it to be more transmissible. Now, if you wear a cloth mask, it might help to prevent that physical barrier, but you can actually breathe the viral particle through the mask. The procedural or surgical mask, although it looks relatively thin, most of them are made of 3 layers. And with those 3 layers, it is harder for a viral particle to pass through those layers. Some person, if they believe that they're in a high-risk environment, so if you're going into a clinic or, where you think that there might be the possibility of coming in contact with somebody who's COVID positive, then in some cases, people are even wearing double masks, double surgical or double procedural mask. And that then gives them 6 layers. So it prevents transmission through those layers, and you're well protected. The highest form of protection that one can get is to use the N95 mask. N95 means that 95% of the viral particles would be prevented from passing through the mask. And in some cases, while they say N95, it's actually about 99% effective, which means that viral particles really would have a tough time getting through the layers of the mask. An N95 mask would actually have 5 layers. And the layers are so built that even if you're in contact with somebody that is exposed, that it wouldn't pass through the mask once you wear it properly. Now, these are the different types of masks. So the CDC, the point that you're making, they're absolutely correct, because cloth masks are effective to a point, but they're not absolute protection. And therefore, my advice to people, if you are in a risky environment, the better thing to do is to wear either an N95 mask or a procedural or surgical mask. these are more effective than cloth masks. So in order of effectiveness, the top one would be N95s, followed by surgical or procedural, followed by cloth mask. Of course, if you wear an N95 mask, but you don't wear it properly, then you are going to get infected. Because a lot of people might have an N95 mask, but they have it below their nose, which means that you can get infected. Or if you have it below your chin, you're exposing both your nose and mouth, and therefore you would be able to breathe in the viral particles. So if you're wearing masks and you want to have protection, then you have to wear it consistently, and you have to make sure that you're covering both your nose and your mouth. And if you stay the distance, at least 6 feet away from someone, then it lessens the chance of you getting infected. So it is a combination that you have to use, and that is stay the distance, because then it reduces the spread from an infected person to you. If you're close up to somebody, you'll get more viral particles coming at you. If you're farther away, it prevents that because it then dissipates. And if you have on the right type of mask, obviously you're not going to get infected once you wear it properly. So I think people have to bear this in mind, more so that we have the threat of the Omicron, and as we have seen in many countries, the rate of transmission is propelling the amount of cases that you have. And in countries where the Omicron is present, every 1.5 to 3 days, the number of cases are doubling. So that's how fast this is spreading. This is spreading faster than anything that we have seen before. And Omicron also has the capability of evading immunity. Some of it can be by vaccines, or some of it can be from a past infection. With Omicron, you can get reinfected. Even if you had COVID before, this particular variant can reinfect you. And that is why we have been advocating to people, even if you had 2 doses of the vaccine, go and get a 3rd dose or a booster dose, because with booster doses, you are going to get protection. So if you have become eligible for that booster, meaning that you're 6 months after your last vaccination, go and get the booster dose, because after 6 months, after your 2nd dose, we would have seen that immunity starts weaning, meaning that you will have less antibodies. And that's the right time to boost your immune system by getting that booster shot. So it's very important. It's all science, and it's logical. So there's a reason why we should do this, and these are the reasons that we're trying to get people to get the booster shot.
Minister, let us talk a little bit about our current active cases of COVID-19 along with our hospitalization status. Where do we stand?
So right now, over the last 24 hours, we had 87 new cases. So that has gone up from the 40 cases or so that we normally see. But I suspect that might be a little bit of the backlog over the holidays. But we have to observe to see whether this is a trend and if cases are going to go up. But over the last 24 hours, we would have seen 87 cases. Currently, we have about 780-something cases that are active, and we have 28 persons who are in hospitals across the country, with 6 of them in the ICU. So we continue to monitor, and we've had 1 death over the last 24 hours. So I really want to urge people not to be complacent, because a lot of times people tend to be very complacent. They feel because the numbers are dropping that, we are over the pandemic. We are not over as yet. We are a long way from being over, and we really need to take all the precautions. Right now, in terms of adult first dose, we are close to 80%. of our population receiving a first dose of a COVID-19 vaccine. That's approximately 410,499 persons getting a first dose vaccine. In terms of second dose, we've had 294,160 persons who would have received a second dose vaccine. That is now 57.3% of our adult population. In terms of our 12 to 17 age group, we have had about 30,251 persons who would have received that first dose. That's approximately 41.5% of that age cohort. And for second dose in that age cohort is 21,568, or 29.6% of that age cohort. Boosters, we've been doing this for approximately a month now. And so as of yesterday, we are at 11,065 booster doses.